The Association of American Medical Colleges is pleased to welcome you to today's webinar, Residency Recruitment Recap, Transparency and Collaboration Across the GME Community. We are recording and will make the archive available after. We will email you once we post it. We did mute all participant audio. If you need help, please send us a message. The presentation includes time for Q&A, and you may submit a question at any time by clicking the Q&A button at the bottom of your screen. It is now my pleasure to welcome Michele Oesterheld. Michele.
Hi, Jennifer. Thank you. And hello, everyone, and thank you so much for joining us today. We're excited to welcome you to this Residency Recruitment Recap webinar, where we're going to reflect on the 2025 ARIS season and look ahead at what's coming for 2026. We know this has been a season of continued change and deep collaboration across the GME community. And that's what today is all about, really sharing insights, highlighting innovations, and reinforcing partnerships that make all this progress possible. But before we dive into what happened during the 2025 season, we're going to start by zooming out just a little bit. First, you're going to hear from PJ Kania, who's going to share how the AAMC is advancing its broader commitment to improving the transition to residency through national collaborations, research, and innovation that extend beyond the ARIS application itself. Then we're going to walk through the ARIS specific highlights, preview what's ahead for the 2026 recruitment cycle, and then hear from our partners at Thalamus on what exciting changes you can expect from them this season. Whether you're joining us as a program coordinator, director, student affairs leader, specialty rep, or just an institutional partner, we're so glad you're here and we're looking forward to today's conversation. PJ, I am going to turn it over to you.
Great. Thank you, Michele. And thank you to everyone who's joining us today. As Michele said, my name is PJ Kania, and I serve as the Senior Director for Strategic Partnerships and Business Development here at the AAMC. And I'm going to spend just a few minutes talking about AAMC's commitment to the transition to residency and academic medicine at large. So what you can see here on this slide is a representation of the AAMC, our mission and our vision, and that is to serve and lead the academic medicine community. This includes the 160 U.S. MD granting medical schools, 12 accredited Canadian medical schools, the nearly 500 academic health systems and teaching hospitals, and more than 70 academic societies. And at the AAMC, we like to think about ourselves as three organizations in one. First, AAMC as a member organization where our efforts are to directly support the work that you are doing at your institutions every day. AAMC as a think tank. We have scholars and experts on staff who study national trends and work on solutions to some of academic medicine's most vexing problems, from school and hospital finance to the future physician workforce and everything in between. And finally, AAMC as a service organization. We provide several solutions that help learners, medical schools, teaching hospitals, and academic societies accomplish their goals. Most notable among our services are operating the MCAT exam and the AMCAS, VISLO, and ARIS application services. One example of the impact of the AAMC on behalf of the academic medicine community was our recent work in leading a lawsuit that led to an injunction against cuts to NIH-funded research. This was done in collaboration with other organizations across healthcare and the education spectrum and supported lawsuits filed by 22 state attorney generals. The work that we do through our service organization provides the critical resources necessary to enable work such as this, which impacts the health of people everywhere. Next slide, please. Now I'm going to briefly talk about AAMC's strategy regarding the transition to residency. Stemming from the concepts and themes within the Coalition for Physician Accountability's UGRC recommendations, the AAMC established 4 priorities that drive work across the AAMC related to the transition. The core focus of this strategy is ensuring optimal, culturally responsive, and safe patient care for all patient populations. And the work that we do at the AAMC is done in collaboration and coordination with many different organizations and groups that support the broader process. The AAMC has 4 priorities in this space. The first priority is focusing on improved learner development by strengthening the learning continuum so students are ready on day one. We also work to improve the bidirectional communication across schools, programs, and applicants. The second priority is providing innovative and intuitive selection and application tools that enable and support holistic review in the residency and fellowship process. The third priority is to provide data and insights to applicants, advisors, programs, institutions, and specialties so the community can make informed decisions and identify critical trends that lead to important discoveries and changes. And finally, the last priority is doing our part to create and promote a clinical learning environment that's safe, equitable, and welcoming to all participants. Next slide, please. This slide includes one example of our work focused on improving the transition to residency. The AAMC recently created the National Collaborative to improve the transition to residency. This collaborative brings together dozens of organizations focused on bringing needed improvement and stability to this critical process. The goals of the collaborative include identifying the most critical challenges, bringing the community together to address these challenges, creating better visibility and learning opportunities within and across these organizations, and enhancing communication. The QR code that you see here on this slide will take you to a website for you to learn more information about this collaborative, where you can also sign up for a newsletter, working groups, webinars, and gain access to new research and resources that are stemming from this critical work. On the next slide, I'm going to talk about the Resident Readiness Survey. This is another example of AAMC's work in support of the transition to residency process. The purpose of the survey is to improve medical school faculty's ability to make data-informed decisions about their medical education practices. The data on this slide here is from last year's survey. And what you can see is that last year, 88% of medical schools were covered by the responses. Those responses came from 72% of programs who were invited to participate to complete the survey, which resulted in 63% of all eligible PGY1 residents being evaluated. My ask for you here is that please participate in the next round of the Resident Readiness Survey for your incoming residents so that information can be fed back to medical schools to enhance accountability and inform areas of improvement. And now for my final slide before I pass it off to Michele, I want to close with an illustration of the critical role ARIS plays in supporting AAMC's work. As Michele mentioned, partnerships with specialties, institutions, and programs through your participation in ARIS enables and supports critical work across the AAMC. And while ARIS is the longstanding leader in GME software, we're now powered by our innovative partner Thalamus. And collectively, we're working to provide a suite of tools that are built by this community and for this community. The transition to residency is more than just a transactional application process. That is just one critical step in a much larger journey each learner navigates, and it feeds into other critical tools learners and others that support them use during the entirety of their medical school experience. Some examples of those other AAMC and partner products include the Careers in Medicine platform. This is used by most medical students and their advisors to provide them with specialty information. This helps them explore specialties, learn more about themselves through assessments, so they can identify and consider which specialties they should pursue and make sense for them. There's the AAMC Fee Assistance Program, which provides more than $26 million annually in support for those most in need. The program recently includes benefits for applying through ARIS. And during this past 2025 residency cycle, there were more than 4,200 applicants who were eligible for fee assistance. And this included MD, DO, and IMG applicants. There's the Residency Explorer tool, which had more than 100,000 users this year. And on average, users spent more than 37 minutes exploring program-specific information to help inform where they should apply. What's great about Residency Explorer is it's powered by source-verified data provided from multiple organizations that support and make up the transition to residency process, including MBME, MBOME, NRMP, ACGME, and the AAMC. The goal of this product is to empower medical students and applicants to explore and identify residency programs where they are a competitive candidate and to find programs that fit their career interests and personal needs. Michele's going to talk a little bit more about Residency Explorer during her presentation. Finally, there's two other areas that are supported by ARIS data, and those are the advocacy work and research work done by the AAMC. Some examples are the advocacy work that AAMC continues to do around increasing the number of GME training positions, and also research as it relates to the future physician workforce. So together with ARIS, these programs help inform the community with transparent data and information. It supports those most in need during this critical process, and it ensures that there is feedback for continuous improvement and evolution across the academic medicine ecosystem. I'm now going to pass it off to Michele to provide more information about the ARIS program.
Thank you, PJ. And I'm going to get us started. Ooh, I hit that too soon. So I'm going to highlight some of the accomplishments in ARIS 2025. So today my goal is to really reinforce our commitment to the GME community and share how ARIS continues to evolve and innovate. I'm going to focus on providing updates in the 3 areas you see here listed on this slide: selection tools, data analytics, thought leadership, and really how each of these shaped our accomplishment this past recruitment season. Our journey over these last 3 years highlights how we've been thoughtfully approaching growth and innovation. In 2024, we focused on evolution, enhancing transparency, refining our tools, and simplifying processes. And then 2025, we prioritized integration, deepening our collaboration with Thalamus, integrating analytics, and customizing specialty-specific solutions. And looking forward into 2026, it's going to be all about innovation, really rolling out new tools and innovative designs to drive equity, efficiency, and better outcomes. This strategic progression has been guided by your feedback, your challenges, and your goals. We appreciate all the interactions we've had with this community. And as we put our strategy into action, we're seeing meaningful impact across every part of the GME community. These aren't just ideas, they're actions that are making a difference. And students are applying more strategically, saving money, reducing stress, and finding programs that support their career goals. Advisors now have clear data at their fingertips, helping students make smarter decisions with confidence, and programs are reviewing applications more efficiently. Institutions are taking more strategic views across programs, and specialties are using national insights to guide policies, address workforce needs, and pilot new innovations. This collective progress reflects what we can achieve when we align across this ecosystem with shared goals, data, and commitment to continuous improvement. Now let's dig into how these results came to life this past season. This year marked a major step forward in our journey to streamline the selection process, not just for programs, but for applicants and schools as well. We fully integrated Thalamus Core and Cortex into ARIS with an API and single sign-on. What used to be separate workflows are now actually unified. In fact, we've seen tens of millions of authorizations successfully take place, which tells us how deeply this integration is being used in real time. Today, over 8,000 programs across 800 plus institutions are connected through this shared infrastructure. This groundwork enabled us to pilot Cortex with 3 specialties: orthopedic surgery, PM&R, and urology. The results: 90% of ARIS participating programs used Thalamus this cycle, and programs benefited from streamlined workflows, applicants had fewer conflicting interviews, and schools and advisors gained better visibility into the applicant experience. This is the kind of transformation we imagine when we say better tools, better decisions, and ultimately better outcomes for everyone involved. While successfully implementing Thalamus for interviews was a huge win, we knew we also had to address one of the biggest sources of stress for applicants, which is cost. Every year, students make tough decisions about where and how many programs to apply to. So this year, we reimagined the ARIS pricing model. We introduced a 2-tier simplified pricing that resulted in up to 36% savings for most residency applicants. We didn't stop there. For the first time, we extended the AAMC fee assistance program to include ARIS, giving qualified applicants an automatic 60% discount on up to 50 applications. No extra paperwork, no hurdles, just support when they needed it most. And over 4,000 applicants benefited from this expansion. And we saw very positive results for both applicants and programs. And when we talk about cost, it's not just the pricing, it's also about access. And so through this program, we're helping ensure that financial hardship doesn't become a barrier to pursuing residency. In total, the program provided more than $27 million annually to support medical school and residency applications. So expanding this program is part of our commitment to the community, not just in words, but in action. So we've improved how applicants apply and how much they pay, but the next question is, how do they know where to apply in the first place? And that's where Residency Explorer plays a critical role. This past season, the AAMC introduced major upgrades, including new data on interviews, program signals, and geographic alignment. We streamlined the interface, made comparisons more personalized, and ensured that all information remains source verified and trustworthy. The response was immediate and enthusiastic. We saw a 47% increase in visitors, a 46% rise in sessions, and a 58% boost in page views. Applicants are clearly using this tool to apply more strategically, seeking out programs that align with their strengths, their goals, and their priorities. And that's exactly the kind of behavior we want to support with every selection tool that we offer. Of course, it's not just about the tools, but it's also about what we learned from them. And one of the most powerful ways we supported the GME community this year was through the data, not just raw numbers, but real insights that drive change. Through Cerebellum dashboards, institutions and programs were able to see their own application, interview, and scoring data all in one place. That level of visibility helped programs course correct in real time. We also brought the Thalamus interview data into Residency Explorer and the Dean's Workstation, giving schools and applicants metrics they never had before. And for specialty societies and leaders, we delivered tailored data packages, which included trends, benchmarks, and signaling results to help guide future planning and workforce discussions. This is all part of a shift from simply just collecting data to activating it, making sure that everyone in the system has the insights they need to make better decisions. And so we've talked about what we've delivered, dashboards, interview metrics, customized data packages, and I'm sure Jason's going to get into these in way more detail later on in his presentation. But let's talk about what this actually meant for the people using them. Because when data is shared, that drives actions. And for applicants, this meant a clear path, a better strategy, more transparency into the interview process, and stronger alignment with the right programs. For programs, the result was sharper decision-making with better insights into their own performance, allowing them to adjust and improve more effectively. For schools and advisors, they reported that 86% of them were able to improve their advising thanks to more realistic and timely benchmarks. And institutions gained a bird's eye view of trends across programs over time, while specialties use this information to shape national recruitment strategies and address workforce gaps. And this is just examples of how data fuels alignment across the community. And as we reflect on the power of data to guide decisions, it's equally important to spotlight how we're leading with values and vision. Innovation just isn't about technology or dashboards. It's also about how we rethink established practices to build on more equitable and mission-aligned selection process. So one of our most impactful initiatives this year has been expanding the holistic review training, which helps programs go beyond scores to evaluate the full context of an applicant's experiences, attributes, and academic metrics. And at the same time, our program signaling initiative continued to gain traction, giving applicants a meaningful way to express their interest and giving programs a clearer picture of who really wants to be at their program. And together with Thalamus, we're now accelerating the ability to bring holistic review scoring tools directly into the program workflow. This is how we shape the future, not just with tools, but also with this thought leadership and research. One of the most powerful examples of thought leadership of how thought leadership is translating into real impact is the continued expansion of program signals. This is now a proven strategy embedded across specialties. In 2025, we saw 23 residency and 2 fellowship specialties participate in program signals. And the majority of them tailored the process to reflect what mattered most to them in their field. And the result speaks volumes here. 93% of all programs using ARIS opted in to receive program signals this year, providing positive benefits to many audiences. In fact, we've now seen a decrease in average applications per program or per applicant for the second year in a row. This is a major milestone that shows that the system is definitely working smarter. And here's the results, real numbers that show real progress. This chart highlights the specialties where we saw the greatest decrease in average applications per applicant compared to the previous year. From public health to urology to dermatology and orthopedic surgery, many of the top shifting specialties are the very ones that embrace program signals. Applicants are applying more strategically, and specialties are seeing the benefits of less congestion and more intentional interest. It's exactly the kind of system-wide shift we set out to create. And to close out this section, we want to highlight what applicants themselves had to say about program signals. 88% of respondents agreed that signals they sent reflected their genuine interest at the time of application. Nearly half said the number of signals felt just right, and many shared they used gold signals for their top-ranked programs and silver signals for their next tier of interest. Listed here are the top 5 factors that drove applicants' decisions: geographic preferences, program alignment with career interest, proximity to friends and family, and the chance of receiving an interview offer and overall fit. While signaling is just one piece of the puzzle, it's clear that it's doing exactly what it's designed to do, bringing greater transparency into the application process and helping applicants and programs connect in more meaningful ways. So as a wrap up, you can see that this 2025 season wasn't just about managing another cycle for us, it was about delivering meaningful change. And as we look into the 2026 season, we're building on this momentum with new pilots, more customization, and continued alignment with your needs. So let's take a look at what's next. AIRS continues to focus on flexibility and specialty-driven innovation. We are rolling out Cortex free to all programs, while also supporting pilot initiatives that include geographic preference screening, specialty-specific short answer questions, and a program signal justification statement, each offered at the specialty level. We're also enhancing dashboards and continuing close partnership with specialties to shape strategies grounded in data and community needs. These pilots allow us to test that what works while also building more personalized and effective recruitment experience. So building on our flexibility, here's a quick snapshot of the updates you'll see for the 2026 seasons, both for applicants and programs. On the applicant side, we've made structural updates on how interruptions and postgraduate education are captured. We're also launching 3 new pilots, and I will talk more about those on the next slide. And we're thrilled again to mention, I know it's probably the second or third time we've mentioned it, but we're very excited about offering Thalamus Cortex as complimentary this coming season. And we're also allowing programs automatic opt-in to Thalamus and program signaling. You no longer have to opt in, you're automatically opt-in. If you do wish to opt out, there is an option in EPM that allows you to do so. And programs will also benefit from expanded custom statuses and tighter integration between Thalamus and PDWS. So as mentioned earlier, we're expanding our pilot work to explore how we can make the application more personalized, meaningful, and specialty driven. First, we're working closely with the AAMC research and development team to evaluate broader models for the geographic preference section. And as part of this exploration, orthopedic surgery and otolaryngology are piloting a specialty level opt-out, which means that programs in these specialties will not see any geographic preferences this season. The goal is to understand how applicant behavior and program decision-making shift without having this information available. And second, we're piloting short answer specialty-specific questions in collaboration with anesthesiology, neurological surgery, and plastic surgery. Applicants in these specialties will be required to complete brief responses within the MyAIRS application. And these responses aim to give programs a deeper insight into applicants' motivation and fit right at the time of submission. And finally, we're testing a new pilot signal statement with anesthesiology and plastic surgery, which allows applicants to provide a brief explanation as to why they're sending a signal to that program. And just building on the momentum of program signaling, we're excited to share the specialties participating in program signals for the upcoming residency cycle. This season's list is now available on our website. And as you can see here, we have 4 new specialties joining. And 3 specialties that are highlighted in yellow are actually changing their approach for the upcoming season. We're also excited to announce that for 2026 cycle, we will include fellowship specialties and program signaling for the first time. This is a significant expansion of the signaling initiative and represents the next steps in our efforts to bring more clarity and alignment to advanced training pathways. These specialties work closely with our team to shape how signaling will be implemented to meet their unique recruitment needs, and we look forward to learning from this initial cycle. And as we look ahead to the 2027 cycle, this is just a quick sneak peek. We're beginning to explore updates to the publication section in the MyAris application. These changes are still in development, but we'll be sharing more in upcoming webinars and some dedicated resources over the next few months. And on that note, to stay up to date on all the application enhancements, the pilot updates, here is a QR code that will take you to the website of what's new for this recruitment season. You'll find links to upcoming webinars, our user guides, and signups for future webinar sessions. And I want to provide a reminder here that we have an ARIS monthly newsletter. So if you would like to receive it, or if you don't, please scan this QR code and sign up. And then we've also provided a QR code to our ARIS stats and preliminary data page. And so now I'm actually going to transition things over to our partners at Thalamus. Jason Reminick, CEO and founder of Thalamus, is going to talk about some current features and what's in store for Thalamus this season. Jason, I will stop sharing and send it over to you. Thanks.
Thank you, Michelle, and good afternoon, everyone. My name is Jason Reminick. I'm CEO and founder of Thalamus, and I'm a former residency applicant to residency in 2012, got stuck in New York City during Hurricane Sandy. Many of my interviews were canceled. Many of you have probably heard this story already, but that kind of brings us to where we are today. My co-founder, Susie, is an anesthesiology residency program director as well. And so I think the story of our team, for those of you not familiar with it, and I do recognize a number of names in the chat, so nice to see everyone. But we have over 200 years of GME experience at Thalamus. That includes folks who are former program coordinators, administrators, managers, DIOs, program directors, applicants, and the like. We're really passionate about building software for GME and bringing solutions to the people that run GME, which is you all. We did celebrate our 10th year anniversary last year. That was a photo at our company All Hands in Austin, Texas. This is now our next photo on the stairs this year. We just got back from our company All Hands in San Diego, California, and had a great time there looking at design thinking and other ways to help promote innovation within the GME space and beyond. Our mission as a company is to ensure that the right doctor ends up at the right hospital to treat the right patients. That was a major driving factor of our collaboration with the AAMC, which will celebrate its anniversary tomorrow, back in April of 2023. In February of 2024, we also converted to a public benefit corporation with the public benefit purpose of ensuring greater access to affordable, high-quality medical education and training, addressing systemic inequities in the physician workforce, and delivering better healthcare outcomes for patients and society. And this drives really everything that we do here at Thalamus. Kind of reiterating on some of the stats that Michelle shared and PJ shared, over 8,000 programs opted in to use Thalamus last year from ARIS across over 800 institutions, including 90% of all residency programs. ARIS Scheduler and Analytics for DIOs was sunset and replaced by Thalamus Core and Cerebellum. Our API connection between ARIS PDWS and the Thalamus products, which included single sign-on, was launched and did over tens of millions of authorizations to date and will continue in the coming years. Thalamus's interview data was put into the Dean's Workstation and Residency Explorer to better guide applicants and advisors in this process. And we also built an AI and machine learning transcript normalization prototype, which is in Cortex. And so in terms of overall interview invitation growth, we did close to 750,000 interview invites this past year, which was an 84% increase from the year prior and shows just the greater adoption of Thalamus across both residency and fellowship programs. Internal medicine led the way with 145,000 invites, which was the first largest by invite size. Family medicine was second, and then peds and emergency medicine were tied essentially for third with 54,000 invites each. Our largest interview day in terms of the invites sent was the 16th day of the residency recruitment season, which was October 10th, with over 52,000 invites. And the second was the 22nd day. So a lot of interview invitations sent out this past year. What's been included in the collaboration previously is we have 5 products. Thalamus Core, our interview scheduling and management tool, our itinerary wizard, which builds itineraries for applicants and interviewers. Cerebellum, which is our data and analytics dashboard that provides benchmarking data and comparison data at both the program and institutional level, as well as Cortex, which is our tech-assisted application, holistic application review and screening tool, and then Thalamus Video, which is our video interview platform. In addition, Thalamus integrates with Zoom, Teams, and WebEx accounts via API and other video interviewing platforms as well. Kind of the big news, as Michele alluded to, that we announced a few months back, is that Cortex will now be included complimentary for all ARIS programs starting this July, which kicks off the ARIS 2026 season with the July fellowships, and then the September residency programs, and then the December fellowships as well. And so really excited to include that as part of the collaboration, as part of the complimentary offerings. Video can still be purchased for the ARIS participating programs. For those non-ARIS participating programs, nothing has really changed on that front. You can still have subscriptions to any of the tools that you've used prior. Enhancements to the Thalamus platform in the past year were many. We are continuously innovating and enhancing the platform based on the community's feedback, based on other solutions we're looking to bring to streamline more workflows and make this process even easier, through innovation funds and collaborations with the AAMC and the ARIS teams. And so kind of the main things that came out on this slide are the ones highlighted and bolded. We had an interviewer report that lists all of the interviewers and who they've interviewed and keeps track of all those stats for broader accreditation reporting and otherwise. We have a bulk user administration management and ways to upload users from a CSV into Thalamus, in addition to the single sign-on and kind of integration through ARIS PDWS and automatically creating those users within Thalamus. We incorporated ARIS Analytics and all of those reports for DIOs into Cerebellum. That included year-over-year charts, as well as work authorization and language proficiency, in addition to the other reports we have on interview rates for programs, geographic maps, self-identification, when interviews are being sent and when interviews are being completed compared to the specialty, and also all of that data being aggregated and rolled up at the institutional level for the DIOs and the GME offices. Additionally, for Cortex, we have this new AI transcript analysis, which I'll review in just a moment as well. We launched the AAMC Thalamus API, which you've heard about, which is actually 20 different APIs and was a major engineering goal of last year. We'll talk about what's coming up this year as well. We fully launched Thalamus Holistic Review, which is our competency-based scoring system that was further enhanced to the broader community, and also the full consolidated application PDFs now coming through the API. We also brought out permissions over the last few months, which is one of the updates for this year also. So for those of you not familiar, this is Cortex. This will be complementary to all ARIS participating residency and fellowship programs for ARIS 2026, again, starting in July. This was built to really help streamline and aggregate key application data using technology for programs so that they could facilitate a better holistic review. It was imagined following discussions with some programs in Iowa that were counting the number of times Iowa was in an application by hand as a marker for how likely the applicants were to go to Iowa, given how strong of a pull geography is. We were able to allow technology to assist with that by doing keyword counts for words and phrases, which are mostly used to find some geographic connection to the applicant. It supports all USMLE and COMLEX scores, including going back to when step 1 was still a number, now pass fail, of course, AOA, Gold Humanism, Sigma, Sigma Phi, and other elements as well, all of the preference and program signals and geographic signals, and it's filterable and searchable and sortable and very similar to ARIS. One of the things we've done is taking feedback from the community and continuing to build out the types of fields and filters you can search for and filter on. Originally, this was built as kind of synergistic or supplemental to ERIS. Now we're getting feedback from the community that they want a broader feature set and filter set. So that's what we're building out there for this season based on feedback we received from the community. Last season, we included tracks supplied by applicants. And so continuously iterating on this, as well as the overall status and the recommended status. There are ways to blind and screen various data. You can build different applicant indexes. It allows for applicant and faculty assignments and kind of everything you need to do to screen and review applications and make those selections for interview, and then those applicants can be transferred to Thalamus Core for the interview part of the process as well. For those programs still looking to use ERIS PDWS, that is not going away. You can still continue to do so. For those programs that want to use Cortex, it will be available to you as well. And really, we have some programs that kind of use both for different reasons as well. Any way or shape you want to use this, you're able to going forward. And so we're really excited about Cortex. Additionally, Cortex was built here and is kind of showing the core clerkship grades. In the original form of Cortex, it was built also to read the transcript and pull out the grades from the core clerkships. The challenge each year, and with COVID and the changes in medical education curriculum, is that the transcripts were changing year over year, and the templates that we were building needed to be continuously updated. Now we've built an AI way using a large language model, which can streamline this even further, and it has some additional benefits, which I'll discuss in just a moment. But this methodology was created and is on our blog, and I encourage everyone who's interested to go look at the methodology as well. It speaks of the limitations of the model and really all of the work that we did to ensure that the model is working correctly. But the basic highlight of it is it takes the unstructured PDF, it runs it through optical character recognition. I'm showing 3 models here, but it can be up to the nth model. It builds a text representation, which is essentially taking the text out of the PDF, running it through a large language model to build what we call candidate structured transcripts. Those items shown in gray match across all of the models, and so we're pretty sure about them. Those highlighted in blue are not the same across all of the models, so they get marked as pending. They go through a manual human review, and they get fed back into the training data set so the model can learn on itself. And so the outcome of this is it's much easier for us to upkeep as transcripts change, as long as they don't change pretty radically. But on top of that, not only does it now give a grade, it also gives a percentile. And so that percentile is based on all of the students that are applying from that medical school into ERIS for that season. It provides not only that grade, but that percentile, as well as the distribution, and provides this, also the grade that the student got in a single standardized window within the software itself. So if the school uses pass-fail, if the school uses A, B, C, D, F, if the school uses honors pass-fail, you're able to see that distribution, and then you're able to use the percentiles and how that student achieved that grade to compare across medical schools in a more apples to apples comparison. There is lots of variability in the way that schools are graded. For any program directors, reviewers, or coordinators that are on this call, I'm sure that's not a surprise. But the distributions vary by school, the grading vary by school, even what is defined as a core clerkship varies by school. I was surprised that neurology is not a core clerkship for about 20% of medical schools. All of the other clerkships listed here are above 90%, but anesthesia is a core clerkship in some medical schools, radiology, emergency medicine. So there's a lot of variability in that. There's a lot of variability in the grading as well. And so this was trying to standardize that. This first pass included all US MD and DO medical schools, as well as international medical schools with the highest frequency into ERIS. There's a number of enhancements we're making for this season. Additionally, IMGs have the most limitations, as I'm sure many of you can imagine, in that there's usually, they can be poor photocopies and strange orientations. They can be in another language. The translation of that language for the same medical school can be done by different translators and result in a different translation amongst the transcript as well. And so we're trying to find more objectivity in this process. We're aware of the limitations. We're trying to work through those as well. But there's also just a lot of variability in the grading itself. So more to come. This was our first foray into AI. Questions are, where are we going next? We're starting to look into personal statements and letters to pull out key themes and otherwise and do further analysis there. We're being very intentional in how we roll this out. We just started with this kind of objective way to aggregate data using AI. It's not making decisions for anyone. It also abides by all the AAMC's ethical and principles for responsible AI. We're working very closely with them. We're working very closely with institutions and programs. Questions we get about various laws in terms of AI making decisions and automated employment decision tools. Cortex falls outside all of that as well, in that it's not making decisions. It's using AI to aggregate data in a more streamlined way to present objective data to the community. And in many ways, we're trying to do this to remove bias from the process while very closely monitoring it to ensure we're not injecting more. What's planned for Thalamus for ARIS 2026? We're excited about a number of these things. We just launched for the SOAP this past season that wrapped up last month, enhanced support for SOAP, where SOAP is now supported within kind of the main season, which is the way we organize and aggregate data within Thalamus. We rolled that out to great success, and it's all streamlining through the AAMC Thalamus API. Cerebellum, we're working on specialty-specific dashboards, which I'll show you in a little bit as well as just enhanced institutional data reporting and ability to send APIs to institutions as well for data. The biggest thing we're working on, and what by far was the biggest ask from the community, was to help with the change management for those programs that want to use Cortex. We are building out a Cortex sandbox environment that will be linked to your main program's Cortex account so that your faculty and your program directors and APDs and coordinators and anyone involved in the application review process can play with Cortex using your program's kind of metadata with filters and scoring capabilities, but with fake applicants in a very low stakes environment before the season starts. And so we're really, really excited about that. That is our big engineering update for this season that our team is working on. We're building in more document permissions and have already both Cortex and Core. For those of you that didn't get to enjoy it last season, it rolled out towards the end of last season and has continued throughout the last few months so that you can blind different faculty to various documents. You can also consolidate all of the PDFs in a single document, which is the way it always was in Thalamus and Cortex prior to the API. We've now been able to catch up on that work as well. On Thalamus video, we had 40% more minutes. We did over 35 million minutes of virtual interviews this year on Thalamus video. Feedback we got from the community was we want ways to test more of this. And so we built an entire systems and network tests that will allow programs and applicants and anyone using Thalamus video to check their browser, operating system, hardware, network, camera, audio in a very step-by-step filtered way to go through this test. A lot of the challenges we saw with applicants and programs this year, 95% plus of every video interaction that we measure goes very, very well. For that other 5%, we saw challenges with networks. We saw hardware that was out of date and sometimes 5 or even 10 years old, operating systems that hadn't been upgraded, permissions, network latency, and other things. We are tracking this very, very closely for the institutions that work with us. We have ways to work with their ITs as well. But on the whole, we had a really, really great season with Thalamus video, but we're trying to provide even more transparency and ways for the healthcare systems, for the programs, for the applicants to check all of this, giving everyone is global and on different networks and worldwide as well, knowing how important those interview days are. We're also now putting in new major updates to Thalamus's holistic review scoring system and UI and UX. We're having discussions with the residency management systems and how to best transfer data to them in the world where we're working with the AAMC and ARIS, and how to get some more interview data into that process as well. And then streamlining onboarding this year. We will be opening up onboarding to Thalamus soon. In the prior years, programs had to opt in specifically for Thalamus. This year, we streamlined that overall onboarding. And when you register for ARIS, you will automatically be opted into Thalamus and get access to Thalamus. It's up to your program to determine what components of this you use, but we're making it even easier for everyone to use Thalamus going forward. We have a brand new brand in terms of Thalamus now, and our new website. We're rolling this out into all of our products in the coming weeks to months leading up to next season. In addition to the Cortex Sandbox, we are redoing the Cortex UI. This is a sneak peek of that. This is more for just visual purposes, but this is where we're headed with Cortex. For those of you that have used it prior, the functionality is very much the same. We've streamlined the number of clicks, given the feedback we get is keep making it less and less and less clicks. We're making the application fully scrollable in addition to having the tabs. You can scroll through the application easier or jump to various sections. We've made the application PDF data even more present and kind of right up front in case you want to open up any of the documents to review them as you're reviewing the full application. And again, having all of the major functionality. And so we're really trying to streamline the program's ability to identify applicants with a strong alignment with their program. Thalamus Holistic Review, as I mentioned, is we're continuing to streamline the usability, implement smart scoring so you can automatically pull in components of the application and give that a grade, and really make that methodology and that user flow even easier to use going forward. Similar with the next generation of Cerebellum, continuing out with the new brand and the new UI and UX to make really expand data insights, including specialty-specific dashboards, and make that even more actionable, and then really help programs and institutions evaluate the success of their season and find ways to improve recruitment going forward. Finally, the Thalamus mobile app is also getting a brand new redesign. We're making it improved. We're making it more simple. We're making it even more intuitive for applicants and programs to experience. We've had tens of thousands of applicant users, or probably now over hundreds of thousands of applicants users, really getting good feedback, scheduling many, many interviews, and want to make it even easier for applicants as we roll out a lot of these new design elements to really enhance their experience and the program's experience too. And real quick, to kind of wrap up here in terms of specialty-specific dashboards, I am most excited about the amount of data that we can provide to the community. We've talked about this since the beginning of the AAMC and Thalamus collaboration. With now 90% of residency programs working with Thalamus, we have near population level interview distributions for specialties and for programs and for applicants. And so really bringing more data to the forefront of that as well. This came about because of using emergency medicine as an example and the unfilled positions they had in 2022 and 2023. We did a study that showed that the number of positions offered in 2022 and 2023 were higher than the number of rank lists that were being submitted, but the community wasn't fully aware of that, or that the application pool had changed to the extent that it had, in that they had a strong decrease in applicants and then an increase in the number of programs. And specialty has since recovered and has had a stronger match. And this year, family medicine, its match rate dropped a little as well. And so the application data has always been measured very well from ERIS. The match data is measured with the NRMP and measured well there. Everything happened in the interview process couldn't be measured because Thalamus had 30 to 40% of the data and ERIS had 30 to 40% of the data. And so this, of course, drives what the broader physician workforce as well. But just this idea of the applicants that are able to match in a specialty, or their match pool, is not the number of applications, it's the number of applicants that apply, minus those that don't get any interviews, minus those that don't match in that specialty or match into a different specialty. And so using family medicine as an example, they have a lot of applicants, and at the end of the process, they have the match rates that they're having. And so using Thalamus and the 90% of programs that worked with us this year, we can plot when invites are going out for the specialty, and this is present in Cerebellum. We can show the distribution of programs and the amount of interviews that they put out. So this is showing 90% of family medicine programs, and we've built this out for each and every specialty. And this is being rolled into dashboards that will be present in Cerebellum for the programs, and we're figuring out where to put it for the applicants to better guide and bring transparency to this process. But programs are sending between about 30 to 250 invites in family medicine, which is the largest number of invites per match spot of any specialty. There's always been concern about interview hoarding. It's kind of outside the scope of this talk for today, but this is what the family medicine specialty curve looks like in terms of interview distributions at 90% of applicants. What you can see here is the mean of applicants receiving interviews is 6.3. The median is 2. There are some applicants that get a lot of interviews. It's a very, very small number, so we have not been able to find any evidence of interview hoarding, but there's also a third of the specialty that doesn't get any interviews. And so when you adjust for then 100%, you have about 3,300 applicants that don't get any interviews. And if you include applicants that only get one interview, it's about 5,000 applicants, which is a pretty large proportion of the specialty. If you remove the applicants that get 0 interviews, the mean jumps to 9, the median jumps to 6. We're able to break this down by couples match. We're able to break this down by self-identification amongst applicants as they self-identify going through the process. We're able to break this down by medical school type, which shows that IMGs make up a large proportion of the applicants that get 0 interviews. And so we're looking at that as well. We're also looking at cross-specialty buckets and the number of applicants that are applying to 1, 2, and even 3 or more specialties. The AAMC puts out great data about cross-specialty application as well. And we've also seen how increasing signals can change the shape of the curve. Here in anesthesia, as the number of preference signals have increased, the distribution has changed, showing the distributions I just looked at. If you turn them 90 degrees, they become these violin plots, where the peak is the peak of the number of interviews that an applicant gets, and the width is the number of applicants that get those interviews. And so we're seeing the overall changes in the shapes of these curves and such as well. And so really the main point here, and I think where the real excitement is from this collaboration, is we're bringing even more and more data to this community at the program level, with Cerebellum, at the institutional level with Cerebellum, now both incorporating the ARIS analytics for DIOs. We are bringing interview data into the Dean's Workstation and the Residency Explorer to better guide applicants and their advisors through this process. We're bringing now these specialty-specific dashboards, looking at the high-level interview season within any given specialty in near real time to see has the market changes from this year to next. We're doing research to understand why applicants have 0 interviews in a specialty or 1 interview, and what characteristics help get applicants get more interviews to better guide at advising as well. And so there's a lot more to come from this collaboration in terms of innovation, in terms of data and otherwise. And we're really, really excited about that going forward. And it is the most comprehensive data in this space now. So real big thanks. And I think we're going to open it up for Q&A now.
Thank you, Jason. Great update. So there is a question in the Q&A asking about the information for the short answer pilot that we're doing for 3 specialties. And we do have those questions, all specialties that are participating in this pilot for the specialty specific questions. All the questions are finalized and they're on the ARIS worksheet, the My ARIS worksheet that is available online. I'm going to have someone post here in the chat just a link to the My ARIS worksheet for this upcoming season so you can review those questions. And then Jason, there is a question about the Cortex sandbox, when that's going to be open for practice.
Yeah, so we're targeting to get that out as soon as we can. We're anticipating late spring, earliest summer, around the June-ish timeline, to give fellowships enough time to get up on the sandbox as well, and obviously plenty of time for residency programs and the December fellowships to get used to it as needed too.
Great. I know there's lots of excitement about that. There was a question here. I think it's been answered, but I will just go ahead and ask for the audience. And it was talking about document permissions available in Thalamus Core, or is it just Cortex? Is it also available in Thalamus Core?
It's both. And so a lot of those permissions are already live in the system. If you wanted to go check it out, you can see it in some of your settings for your program, and you're able to adjust which user roles are able to see which documents, which I know was a big ask from the community.
Okay, great.
Yeah.
I'm going to go back to some of the questions that were answered, because we don't have too many. If you definitely have questions, feel free to put them in the chat. We have a few more minutes before the webinar officially ends. There was a question distinguishing between Residency Explorer and Frida. They didn't know if they were 2 separate databases or if they were one and the same. So I can take that one. They are definitely 2 different systems. I think some of the same information coming from GME track feeds into both, but it has not been renamed. They still exist as 2 separate systems. And let's see. Jason, there's a question about the video application. It's asking if it's just being reviewed. Applicants commented, I guess, that it may have had some user issues, I think, compared to Zoom or other platforms. But was there anything that you wanted to add about your video platform?
Yeah, again, we tracked this very closely, and we did over 35 million minutes of video interviews, and we're monitoring each and every session, and we're looking at the how robust the platform is, and overall getting very, very good feedback. I think there's obviously concern when there is challenges, and there's challenges with every video platform given the stakes of these interviews. This is why we've built that video test and that network test, looking back at all of the data, and we have engineers that are analyzing this day in and day out, and product managers specifically in charge of this product, understanding how we can go from 95% to as close to 100% as possible. And the 95% is about as standard with the other video platforms as well. And so really trying to understand why there might be challenges. Is it a network thing? Is it a bandwidth thing? We are continuing, obviously, to always update the software and what's running underneath it, but it is a major video conferencing provider as well. So this isn't something that we've kind of hacked together. This is very powerful software where the number of users in GME is a fraction of people that are on the overall system. And so it's feedback that we take to heart. We know how important these interviews are. This is why we built the network test. This is why we keep building more tools so that people can test and learn and do test runs and such as well, and dress rehearsals. And so we'll be continuing to do that going forward. But I think it's a great question and a great point.
Thank you. There was a question about the two specialties that are highlighting the program signal statement. That would be for anesthesiology and plastic surgery integrated programs for this coming season. So just wanted to share that. Let's see here. There's one in here where will there be more options by role to limit who can see the ranking of applicants? I assume that's one for you, Jason.
Yeah, I think only some roles can access the rank list. I think more broadly across the entire system, we're continuing to work out ways to allow permissions to be as configurable as possible. I think every single part of this process, some institutions and some programs want some people to see where others don't want those same people to see, which leads then to more configurable permissions, which are kind of the things that we've been working on for each and every feature. I'm suspecting that eventually we're going to get to the point where there are so many permissions, we're going to get feedback that there's too many permissions, but we're continuing to build out that permission set so that everyone can have full control and allow folks to see what they want to see and or not see. And so it's a consistently moving target that we keep moving each year and bringing more permissions. Last year with the documents, before that it was various screen fields and blinded fields as well. And I know the rank list has been a question for some also now too.
Great. There's a question in here about the interview offer data being transferred back to the DWS this year. I'm not sure. Jason, do you want to talk a little bit about that data, or PJ, is there anything that you want to mention from your side?
And we can follow up with the person who asked this question. I know that there have been changes to the reports in the DWS to better represent the data in some of the more legacy ways that the DWS reports included interview data. And I know that there's some more enhancements in the works in the lead up to the upcoming 2026 season. So while all the data is continuing to flow over from Thalamus to the AAMC, and the ARIS product teams continue to work on the features, capabilities, and layouts of that data in the DWS report. So more to come, and like I said, we'll have someone reach out directly to the person that raised the question.
Yeah, and I also know that we do plan to host some additional webinars for the Dean's Workstation as we prepare for this upcoming season. I know there's still some enhancements and such going on with the data transfer between Thalamus and our systems. And just scrolling through. Go ahead, Jason.
Yeah, there's a question about the Thalamus video and being able to manually pull or place applicants, interviewers in and out of video conferences as opposed to the waiting for the time clock to run over on its own. And so this is kind of an intentional decision we made based on user feedback. There are ways to stop interviews. You can close out any room and that immediately stops it. We built it so that applicants and reviewers can go in through their own schedule, similar to a human would open a door to walk into a video room. And this was really great feedback we've gotten over the years, going back to COVID, and a differentiator of our product in many ways. And so everyone kind of navigates through their own way themselves, specifically so that the coordinators and the administrators don't have to play air traffic controller, moving people into and out of breakout rooms. They still have that overview screen where they can close any of the rooms and or let people know times left and send in virtual knocks and notifications. But this allows for a lot more streamlined flow overall. I know it's different than some of the ways people had done it previously, but we've gotten a lot of really great user feedback on it, and that was the intentional product decision we made there.
Great. Well, I know we are coming upon 2 o'clock, and I believe I'm going to pass things back over to Jennifer to wrap us up. But thank you both, Jason and PJ, for your time today, and thanks to everyone that joined. We definitely appreciate the attendance.
Great. And thank you, everybody. Please do give us your feedback on the program. That will the evaluation will pop up on your screen as soon as we end. We did record the session. We'll email you once we post the archive. On behalf of the AAMC, have a great day.